Thank you, Madam President. My question is for the Minister representing the Minister for Health, Minister Gallagher.
Order.
We currently have more than 265 cases of Mpox or monkeypox since the start of the year. Scientists are also worried about avian flu coming from birds in Antarctica and spreading to wildlife and potentially to humans. We were caught short by the last government's response to COVID-19, even though experts had warned that a pandemic was a case of when, not if. Out of the 19 recommendations from the Senate Select Committee on COVID-19, how many recommendations has your government put in full?
Thank you, Senator Lambie. Minister Gallagher.
Yes. Thank you, President. I thank Senator Lambie for the question. We did provide a response to that Select Committee some months ago. So that would be, and I can't tell you the number specifically, Senator Lambie, I just can't recall it, but you raise an important question around Mpox, and the National Incident Centre has been activated to monitor that situation and coordinate the Australian government response. Australia has not recorded any cases of the new strain of Mpox virus circulating in Africa, but obviously the systems that are in place, and we have learnt from the pandemic, I think about our emergency health response, have been activated and it is being actively monitored. But that National Incident Centre will allow a scalable and consistent approach to governance and the coordinating operations across government and departments. I should say the advice is that the current risk to the Australian public from Mpox transmission is low to moderate. The public health risks to Australians will continue to be monitored and inform any adjustments to current activities. There are 2 vaccines available for use in Australia, and both are currently held by the National Medical Stockpile in case of a surge in cases within Australia, and the department is reviewing the vaccine stock in light of the African outbreak.
Thank you, Minister. Senator Lambie, first supplementary.
Thank you. Out of the 19 recommendations so far, your government's had the ability to put in 3 in full. In the final report of the Select Committee on COVID-19, which was handed down in April 2022, after more than 2 years, the government has not released its response to the report. Minister, do you understand that the next pandemic might be just around the corner and will not wait for you to implement the recommendation before it starts infecting people? When is your government actually going to get around to releasing a response?
Thank you, Senator Lambie. Minister Gallagher.
Sorry, I understood that we had responded to the Select Committee report, but I will check that. There is another piece of work underway that is reviewing the pandemic response, and I believe that must be finalised shortly. But I would also say that the systems and processes put in place and learnings that were experienced under the pandemic have helped shape the response now. So things like the Mpox, and the work that's being done on the CDC has been informed by the pandemic response, and indeed the National Incident Centre, which is being operated now in light of the Mpox outbreak in Africa. So I would say that the learnings are already being implemented, but I will check and see whether there's anything further I can provide about the Select Committee report, if that's what I heard, if that's the report you're after. Yep.
Thank you, Minister. Senator Lambie, second supplementary.
Thank you, Madam President. The first key recommendation from the COVID-19 Committee was setting up a Centre for Disease Control. In 2023, your government allocated $91.1 million to be spent over 2 years. Can the Minister tell me how much money has been spent so far?
Minister Gallagher.
Thank you. I'm not in a position to specifically answer how much money has been spent so far, but that is work that the Health Minister has been progressing in discussions with the state and territory counterparts, and I'll see if there's anything further I can provide on that. I might just have some extra information to provide on that. That's right. Okay, so the independent panel that will report soon is looking at this, and it's expected that findings from the inquiry will inform the final design and scope of the CDC. So that work is underway and is being led, and hopefully we will have that report soon.
Thank you, Minister.